Good morning, everyone, and welcome to our Lively U Virtual Learning Academy program. This program is making the most of your doctor visits, and we welcome Nicole Sheehan, doctor from McLaren St. Luke's Family Medicine, here to present to us today.
Hi there. Like she said, I'm Dr. Sheehan. I'm a second-year family medicine resident over at McLaren St. Luke's. So today I'll be talking to you guys a little bit about making the most of your doctor's visit. So we'll talk a little bit about expectations, kind of like how do you prepare for your visit? What do you bring to your visit? What should you expect at your visit? And then kind of what things should you be doing after your visit? So I always like to tell my patients it's very helpful for us as physicians, when you come prepared. So what do I mean by that? So if you have a list of questions that you'd like to ask or problems that need to be addressed, kind of write those down on a piece of paper. But I tell people, try to prioritize them. Try to pick, what's most important to me today and what is number 2 and number 3. Because we are limited sometimes to 15 to 30-minute appointments, depending where you're at. So sometimes we're only able to address maybe 1 or 2 concerns, maybe 3, depending how in-depth those concerns are. So try to prioritize what exactly is most important to you today. If there's something that your physician notices that should take kind of a precedent and be addressed that day, they should discuss that with you and say, hey, your blood pressure looked really high today. I think we need to address that instead and maybe one of your concerns. So having a list of kind of what you want to chat about and then being able to discuss that and kind of set an agenda with your physician at the appointment of what you're going to address that day is always really nice. If anybody needs a translator or anything, it's always nice to let the office know ahead of time. We have iPads that do our translation for us. So even if you don't let us know ahead of time, we're still able to take care of it, but it's always nice to prepare. If you're sometimes just have difficulty remembering exactly what the doctor said, or you just want a second set of ears, we encourage you to bring someone with you to kind of have that second set of ears or to write stuff down for you so you can be engaged in your appointment. Obviously with COVID, certain offices are only allowing a certain amount of people in, but so we have to take that into consideration. So outside of COVID, though, we definitely encourage that as well. It's also good if you have a significant other or a family member or a friend that knows you really well, they can also give some input too. So that's helpful as well. If you need to, for any instance, cancel your appointments, it's always nice if you give us 24 hours notice. I know that's not always feasible. Sometimes things come up last minute. It depends on your office, what their policy are, because there are some offices that will charge late fees or, if you cancel within 24 hours, they'll charge you a certain fee. So always kind of make sure you know that policy at your office. And then if you're a new patient or you need some paperwork filled out by your physician, it's really nice if you guys can fill that out ahead of time. If you need a document signed, if you're on disability or you have something that you need signed on our end, at least if you could fill out your portion of it, and then so we know exactly what we have to do, that's helpful as well. So that's kind of how you prepare for your visit. So what should you bring to your visit? Well, I always encourage people, it's so helpful if you can actually bring in your medications, that's wonderful because we can see exactly what you're taking. Sometimes that's not easy to do. People have a lot of medications. So if you keep a nice written list, and what am I looking for on that list? So I would want the name of the medication, what's the dose you're taking it, and how often are you taking it throughout the day? And if you keep that updated on a list, if you have, quite a few meds, then that's really nice for us to know exactly what you're taking. I encourage you on those lists, not only to write down medications that are prescribed to you, but we also like to know any supplements that you're taking as well, just to make sure they're not interacting with the medications that you're prescribed. We also, if you keep a list of all the doctors you see, so if you see a heart doctor and a lung doctor and your primary care doctor, even your eye doctor and your dentist, it's nice for us to kind of know who's your circle of care. So that way we know, we should, as your primary care provider, hopefully we like to request records so we can keep an eye on what everybody's doing because we're kind of treating you as the whole. We're the captain of the team. So if you have a list of your physicians that you see, it's really nice for us because we can get records from them and just kind of keep an overall look on things. If you're a diabetic or you have high blood pressure, it's always nice if your doctors ask you to bring in your blood sugar logs or your log of your blood pressures. They're really helpful for us when we're trying to change doses or if things aren't stable at the meantime, we can, adjust insulin if we need to adjust blood pressure medicine. So if your doctor asks you to record those things, it's very helpful to see kind of what's going on at home because we're only getting a glimpse of you when you come into the office. If you wear any glasses or hearing aids, we always encourage you to bring or wear those as well, as it will maximize what you're able to hear and see throughout the appointment. If you are a note taker, which I am, I love to write everything down. I know we're very technologically sound now these days, but I still have a planner and I like to write things down and I like things on paper. So if you are one of those people, bring your date book or calendar. So if you have to get lab work done, or if we need to set up a follow-up appointment, you can write that down at that time. We always will print out a sheet for you that has your next appointment, but sometimes those things get lost. And then if you were in the hospital, if you went to like an urgent care or an ER and you have any of like discharge paperwork or any other paperwork you've gotten from other doctors, always bring that with you as well so we can take a look at that. So kind of now we'll transition to what should you expect kind of at your visit. So we understand as physicians, we are not always on time ourselves. Things can happen throughout our day that kind of get us behind. And so if you're the first appointment of the day and you show up 15 minutes late, that can kind of throw off our whole day. So we appreciate when you're on time. We try to be on time as much as we can. And then, even if you're a new patient, it's always kind of nice if you're 15 minutes early as a new patient, because sometimes we try to mail out our new patient paperwork, but sometimes we don't. So at least it gives you a little bit of a leeway to fill out your paperwork ahead of the appointment so that we can put that in the system and maximize our time that we actually get to spend with you. Because usually, and all of you probably can attest to this, when you go to a doctor's appointment, you spend a good 5 to 15 minutes with the nurse trying to get your information into the computer, get your vital signs. So we want to make sure, if you can get there a little bit early, we always appreciate that to maximize the time that we get with you as well. Always discuss with your physician kind of what the agenda is for the day, like we discussed before. And we should, we as physicians should say, okay, today we're going to discuss your blood pressure and your diabetes, but we see you have a couple other things you want to discuss. Maybe we can get to one of those if we have time. And then, if we want you to do any labs or imaging, we will ask your physician, so once I get this done, how am I going to get my results? Me personally, I tell my patients, if they're getting lab work done, if you don't hear from me, everything's good. Certain things, like if you get an x-ray or a CT scan, I usually have myself or my nursing staff call out those results to the patient. And then obviously if anything is abnormal and I need to get a hold of you, I will call you that way. So I encourage you to kind of talk to your physician how you're going to get your results back. And then if you need to set up any future appointments, make sure you're doing that with the nurse. And usually the physicians will be telling you and the nursing staff to set those up. And then obviously we always go through a lot in the appointment. And I think it's important as a patient, because I've obviously been to some doctors as well, to kind of, if you can summarize in your own words, like, okay, doc, I heard you today. So here's the things we're doing. We're getting my lab work done. I'm getting an x-ray, and then we're going to follow up in 2 weeks so that we make sure everybody's on the same page, because sometimes we hear certain things and we miss some other things. So we want to make sure that both of us are on the same track with the plan. So that kind of transitions us to reasons you should call after and things you should do after your visit. So as I touched again, if you have any labs or imaging that your physician wants you to get done, try to get those scheduled and get them done in a timely fashion. Keep your follow-up appointments, especially if you have chronic medical conditions. You should be seen on a routine basis to make sure that they're staying stable or if things are changing. So keep your follow-up appointments. If you need to change them, just make sure you're calling 24 hours in advance and changing them. If your doctor gives you any referrals for any instance to like a heart doctor or a lung doctor, make sure if you follow up on those referrals. Something I see commonly is people will come back to me and say, you sent me a referral for the heart doctor, but I never heard from them. So what I tell my patients is I usually give them the phone number of where I'm referring them. And I say, if you don't hear from them in the next 3 days, give their office a call. So, that way you're not coming to me a month from now and we still haven't gotten you set up with where you need to be. So, talk with your physicians about that, if they can kind of give you the phone numbers for the referrals they're setting up for you. Obviously, if you're going to change any medications on your own, it's always a good idea to call your physician and let them know, just to make sure that, you're not decreasing a blood pressure medicine when you really should be taking a different dose. So make sure if you're changing any medications, then you should definitely keep your doctor in the loop. And then if we prescribe you medicine and for some reason you go to the pharmacy and you're like, this is just really expensive, don't necessarily get that medicine that day. Please call your doctor's office. Sometimes there's generics, there's alternatives, and maybe it is the only medication that's going to do exactly what the physician would like. But at least call and see if there's other options for you, or if we can work with the pharmacist to see if there's any like patient assistance or things like that. And then as well, if you ever go to the hospital or you go to the hospital and end up in a skilled nursing facility or an ER or anything like that, give your doctor a call within 48 hours of leaving the hospital. Usually they'll give you paperwork to follow up with us anyways, but it's always nice for us to know, hey, you were in the hospital, we should follow up and make sure things are okay. Sometimes, they do fax us documents, but sometimes we don't get those for 2 or 3 weeks. Depending where it's at. So it's always good to keep us in the loop as well. And then lastly, if you change your address or your phone number, it's always good to call and let your doctor's office know in case we're trying to get a hold of you. So I kind of talked on a lot of stuff. So I'm going to open it up to questions at this point.
All right, thank you, Nicole.
Yeah.
I'm going to go ahead and allow everyone to unmute themselves, and we'll stop our recording here today.